Hi there, thank you for joining me for another live stream here on behalf of safety.com. We're looking at another HSE prosecution. This one has actually happened before the last one that we published, but having read through the case, it was quite shocking in terms of the injury that was sustained. It wasn't really a large fine or punishment, so to speak, on behalf of the company, but certainly there's some learning points here that we can take away. We had to make the assumption that the company was quite small. You can see the information on the screen right now, just up on the left hand side, gives you a little bit of a rundown as to what happened here. So I'll just talk through it for you very quickly, as I usually do. So this one happened in a factory where the company itself, their main objective or activity was to cut pieces of metal. So that is often termed as metal slitting, and you have slitting machines. So effectively it's splitting the metal or cutting the metal into different size pieces. The incident here happened whenever one of their workers was setting a machine up to perform the task of slitting that material, that metal material. As the person was getting the equipment ready, then that is when the injury occurred. Let me just show you, I'll remove this photo and put up a photo of the machine that was involved here, just to give you a bit more context. So as you can see, it looks like two rollers here where the metal would go through when it's being cut. Obviously there'll be blades involved there and cutting instruments. So the person who ended up injured was trying to set the machine and check that the blades were in good enough condition, I suspect, and sitting in the right positions for the cuts to be done. And it didn't go into detail on the case itself as to exactly what happened. However, you can make the assumption that the machine was powered up at some stage during this setting activity, and the person got their hand caught in the machine. Subsequently, their hand was then really treated like a piece of the metal going through the machine. It was sliced, and as a result, the person on one of their hands, they had degloving, which, if you're not familiar with that as an injury, it's quite brittle, similar to scalping. If you think about the removal of your scalp from your skull, it's really taking the soft tissue and skin and ripping it away from the bone and muscle. So very difficult to think about, very traumatic and damaging injury. And so that's what happened to one of their hands. On the other hand, one of the fingers was damaged quite severely, and that ended up in an amputation. The person, as it says on the case here, spent quite a number of days in hospital going through different surgeries, skin grafts, and so on. So really quite traumatic, as I say, in terms of the injuries that happened here. The company itself were fined £12,000. Now, that might suggest that perhaps the feelings on behalf of the company weren't that severe, or perhaps, as I mentioned earlier, we are dealing with a very small company who maybe have a reasonable history when it comes to health and safety, but we'll not dwell too much on that. Obviously, we're here to pick out some of the things that we can learn from this and use as instigators for us as managers, HSE professionals, or otherwise, just to think about, to avoid this type of scenario. So the first thing, and this is probably a repetition again, as I keep saying, try not to repeat too much in each subsequent video, but one of the things that was picked up in the case file or the report that was put out was just that the risk assessment wasn't thorough enough to take into account the activity that the person was doing when the injury happened. So the setting of the blades and the checking of the blades and the instrument before the machine was powered up to do the cutting process, that wasn't fully taken into consideration, and the risks associated with it weren't dealt with or controlled adequately. And that's the key feeling here that was communicated as part of this case. So what I would say to you there is, take a check on any equipment such as this if you work in an engineering type environment, or anything similar that could potentially cause injury, and ask yourself, are the safety controls proportionate to the potential for risk of injury, and does the risk assessment cover it adequately enough? Another thing I would say here as well is, just from experience, just watch out for the how can I say this, we've done this for years attitude that you might come across in a lot of environments where people have maybe done something for a long period of time, and because they've got away with it in terms of not getting injured, they feel like it's safe. However, this may not, of course, be the case, and this may have been the case in this instance, but I would see that a lot, and we would see that a lot during doing our consulting type work. So that's something I would say to keep a keen eye out for, and really make sure you understand exactly what activities are taking place. And I do cover that repeatedly with these reviews. The second point is really just reiterating that then. So making sure that when you're doing your risk assessment, do you understand all of the activities that take place for the machine, not just your daily operation of the machine. Maybe a machine like this might be set to do a week's work on one particular type of material, for example, but once that run of work and that production run stops, it may need to be reset for the next production run. And in this example, that's where the person would have to reset the blades and the cutting instruments. Does your systems of work and your risk assessments fully take into account what type of risk is existing there when this sort of maintenance and less frequent task is being done? So that's what I would just say as the second point. Make sure you're digging deep and covering all activities when you're looking at your risks and trying to manage them. The third point then is just, and this is all along the same lines really, it's just to watch out for blind spots. And blind spots, I mean, again, areas where you don't see the work obviously taking place, but it does happen every now and again. And I've said this previously, it's just because it happens so often. And even, there may be supervisors or managers that you work alongside depending on your role, and even operators who won't tell you about certain things that they actually do. And that may be for various reasons. It may be because they might forget about it because it's so infrequent, or it may be a case of, well, if I tell a person that I do this particular piece of work, it is a bit risky and I don't really want to open that can of worms. But if you're the person that's in control of the business or in control of helping to manage risk, you need to understand what those activities are. And if you don't find out what the blind spots are, the only way you're going to ever find out about it is when an accident actually happens and someone is injured. And of course, at that point, it's going to be too late. So that's it. That's the three main points out of this one. Again, quite short and sweet. Hopefully it's helpful for you. And just to finish this off, please don't forget that we have a promotion on our safety.com website where we're trying to aim for giving away 1 million free courses, and that's going pretty well. We're up heading towards 30,000 that have been delivered so far. So I thank you for your support on that, and would really urge you and ask you to support us if you can. Share the resources. We'll put some links below this video, and please do subscribe to our YouTube channel. We'll be continuing to release more and more material on this channel, and hopefully it is helpful for you. Thank you for watching for this one, and we'll see you in the next video.